Good evening, students, dear aspirants of NORCET. I think the notification came. We are to the milestone. Yes. Today, I am going to deal with a interesting topic, like basic topic, but there is lot of high-heeled questions. Okay. Welcome to the session. Good evening, all. So, from the community health nursing, we are going to see, right? Community health nursing is a vast subject, okay, but which is having a high yield, okay. If the question paper is tough, so you may tell, sir, the questions came from community health nursing, I didn't go through it, it is very difficult. So like that. So from that, from the basics of community, we are going to learn some important topic and MCQs. I came up with two topics. So let me give you a clue so you can find the topic, okay. So before that, kindly confirm whether you hear my audio and the video is visible or not, okay. You can just tell me. Anyone? Yes, good evening. Rajakumari Rajadurai. Yes, good evening. So let me tell you the clue, okay. What is the clue? That is, for everything is happening, we need some sort of prevention. We are having some category towards that. And to overcome an infection, what we need? To overcome an infection, what we need? During COVID-19, what we people were telling? Your one thing is low. If you have this thing good, then COVID-19 will not be get attached to you. You will not get that infection. So for that, to prevent infection, to fight against infection, what we need and what measures we'll take in the levels. So that is a topic today. Anyone can tell? Yup. Come on. Audio is good. So I have checked in my phone. So audio is good. You can chat. So you can turn up your volumes as well as you can check your internet connections. Okay. So what we are going to discuss, that is levels of prevention and immunity. So definitely next week we will discuss some important programs. Okay. Don't worry about that. So for that you need some basics, right? To attain any programs, you need to learn some basics. For that, today we are going to discuss about levels of prevention and immunity. If you have good immunity, you can fight against infection, right? Yes. So students, please tell me in English, mera Hindi mein thoda thoda mein malum. So you can chat in English so that I can give you the good feedbacks towards you. Okay? Yes. We will go to the topic. So come on, tell me, what is prevention? What is levels of prevention? So prevention, in the sense, we are going to prevent, right? One thing is going to happen. Before that, we are going to stop the event, or we are going to take some measures according to the category, according to the levels. Okay? Yes. Coming on to this introduction, levels of prevention, what is actually tells? Okay? Levels of prevention, what is actually tells? It helps in breaking the chain of infection, chain of a disease progression. Chain of disease progression it is doing. So disease is happening. For example, I will tell levels of prevention. If they put a question like reasoning and assertion, if they put, you should able to answer. Okay. Levels of prevention, reasoning and assertion question if they ask. So what is actually does? You can see here. What is the chain? Primarily, one thing is happening. For example, a child is having a fever in a particular area. You are going to identify the cholera. Is cholera is present. So from what it is travel? It is from fecal route. Okay. Then sanitization measures, hand hygiene, everything you are going to give to the community, as well as for the particular people you are going to do specific protection, like management related to the cholera. Cholera is in diarrhea stages of 1 or 2, then you are going to stop that disease chain, then you are going to prevent that to progress. Okay, from grade 2 it should not go to grade 3, so it should reduce. For that we are going to take the measures, for that the breaking of the chain of disease. Okay, what we are focusing, it is focusing preventing diseases of different stages, at different stages. If stage 1 cancer is diagnosed, then we are making measures, we are going to treat with radiation, with surgery, but both adjuvant therapy, neoadjuvant therapy we are going to give to stop the cancer progression to stage 1 to stage 2. We are stopping the cancer progression. Okay, for that we are going to take the measures, that is at different levels. If it is grade 3 of cancer, then we are going to stop the disease on that stage, that is at different stages. Okay, yes. Is it clear for you all? Okay, yes. Then before risk factors appear, this is the very, very important point you should note. Before risk factors appears. Before risk factor, in the sense we are targeting the victim, that is vulnerable population. Vulnerable population in the sense what it tells. These people are more prone to get this type of infection, this type of disease. Hereditary diseases like non-communicable diseases like diabetes mellitus, hypertension, these are some conditions. Like we can say that if family history is there, you can have these conditions in future. So we are targeting before the risk factors appears. Then before this disease onset, like screening of hypertension, screening of diabetes mellitus, screening of cancers for the woman during the reproductive age and also the postmenopausal age for cervical cancer risk. Okay, that is before disease onset. Coming on to the next, after the disease onset but early stage. Stage 1 diabetes mellitus, like stage 1 hypertension is diagnosed, then we are going to treat, like dietary modifications we can give. If the age is less, we can give dietary advices so that it will not progress to grade 2 hypertension. Okay, that is the thing. After the disease advancement, after an RTA, road traffic accidents, if there any fracture happened, then rehabilitative measures we can give. Okay, that is after the disease advancement. It is advanced. If hypertension, if cancer is advanced, we are going to treat that. Okay, and we are going to give rehabilitative measures to the patients or the community wellness. Okay, yes. Is it clear? Students, it is clear? Anyone can tell? Hope you understood the concept clearly, right? Okay, let me discuss the types of prevention. Here, this is very high hill. Here, you will be getting the MCQs. Okay, here, you will be getting the MCQs. Actually, primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Here, what is primordial prevention here? Come on, tell me. Primordial prevention. Primordial in the sense, okay, what is actually tells us? Primordial prevention, actually, no risk factor, keywords I am telling, okay, no risk factor, but possible to be risk and can get infection, can get the disease. Okay, like we can say a school children, we are creating health and wellness programs to them. Dental hygiene we are going to give for the students, okay, for the children's. Then smoking and alcoholism awareness, right? If you consume alcohol, if you get to smoke, you will be getting the health disease conditions like lung cancer or any liver cirrhosis can be the risk factors, and you will be having lot of health issues, your family and economic status and all you can explain to the people who are not risk, but in future there may be a risk for this group. That is the primordial prevention. No risk factor, but possibility of the risk factor to get the disease condition. Okay, that is primordial prevention. Coming on to this primary prevention, in the sense there is risk factor. Risk factor is there, so that we are going to create an awareness and prevent. In that we are having, that is health promotion and specific protection. We will discuss in detail in the upcoming session. Okay, in the upcoming slides I will discuss. First you just listen. In primary prevention, risk factor is present. In example, I can say vaccination. For hypertension is there in a family, there is a risk factor is there, so that the family members, the beneficiaries can get the disease condition. Hypertension can they get, and coronary artery disease, is there any disease condition is there in a family, they are prone to get like that. Like malaria, dengue, awareness we can give, because in a particular area there is chances, so that we are going to create an awareness. Okay, but health education comes under this primordial prevention. Health education, no risk factor, but there are possibility for this people can get the infection in the future, can get the disease in future. But primary prevention, it focuses on environment as well as particularly an individual where there is high risk chances. Okay, risk factor is identified. Coming on to the secondary prevention, what it tells? Secondary prevention, disease is onsetted. Disease is onset of disease is there. Onset of disease is there. In that, we are going to stop the chain where treatment is started. Okay, treatment is started, and we are going to monitor the progress, as well as we are going to stop the chain of infections, chain of disease. Okay, that is called secondary prevention. Examples, I will tell the example for hypertension alone, okay, so that you will not confuse. Okay, correlate with other conditions. You can see hypertension is diagnosed, okay, and then we are going to start antihypertensive drugs. That is comes under secondary prevention. Coming on to the tertiary prevention, rehabilitative measures, we are going to take. Yes, specific protection, health promotion is primary prevention only. From I have done this, you can see primary prevention only, health promotion and specific protection. Okay, is it clear? Rehabilitative measures and the progress of the disease we are going to stop in tertiary prevention. Okay, diagnosing and starting initial phase of treatment, that is secondary prevention. Okay, identifying the risk factor and stopping the condition itself, primary prevention. Without knowing the risk factors, generally we are going to give future there may be a chance of disease condition, that is primordial prevention. Okay, okay children, it is clear? Yes, good evening, good evening. Okay, now in detail we are going to see about each prevention, and next we are going to see immunity, and next we are going to solve the MCQs. Okay, yes, today you are going to be thorough in preventions and immunity. Is it fine children? We will learn today. Are you ready? Yes. What is the definition? Already I have told. Preventing emergence of risk factors. Okay, just the keyword you just remember, before risk factor develop, that is pre-risk stage, we are going to identify. What may be the examples, interventions like health education. Is there any policy changes we can do? Lifestyle modification comes under primordial prevention. Lifestyle modification for obesity is diagnosed, then it comes under primary prevention. For individually we are going to give obesity, lifestyle changes we are going to give means, if the individual is diagnosed with obesity, then we are going to do health education, then it comes under primary prevention. Without knowing the risk factor, future there may be a risk. For example, you are going to give an awareness program related to obesity for a particular group, like school age group children, like the age of between 8 to 12 you can take. For that group, if you are doing any health education activity on lifestyle modification in prevention of obesity, then there is primordial prevention. Okay. Now I will tell an example. Dental caries is a condition, right? Dental caries. Okay, dental caries is a condition. Who is the vulnerable population? Who are the vulnerable population? Who are the vulnerable population? Like we can say, like 3rd standard students from the age group of 8 to 12 years. 8 to 12 years. These are risk factor identified. We have already identified the risk people. So you can tell me whether it is primordial or primary. Or primary, you can tell. Primordial or primary prevention. Now you can tell children, come on. School going children, yes, school going children are more prone to get. Now, dental caries, video hosted teaching, health education activity as a nurse you are going to give to the school children. Now you can tell whether it is primordial prevention or primary prevention. Health education activity. Because this comes under primary prevention. Why I will tell? Because the risk factors are identified, because these children are more prone to get dental caries. Now, you can tell me smoking and alcoholism, okay, related health education you are going to give, okay. To target population is 2 I will divide. One is 8 to 12-year children. Another one is college students, that is adult, early adulthood, 18 to 24. Okay. Come on, tell me now, in this age group, you are going to give this awareness. Come on, tell me what is the level of prevention in this? These two level of prevention. Yes, good, good. Bipolar disorder. I don't know what is the name behind it. Mood swings you will be having. Now you should be under manic episode, okay? Because you are going to learn MCQs, okay? Yes. Good evening, Priya. Good evening. Yes, Rajkumari Rajadurai, you are correct. Now tell me this. Now tell me this. Smoking and alcoholism, you are going to create an health education. Health education. And smoking and alcoholism related health education you are going to give for 8 to 12-year children and 18 to 24-year children. Now come on, tell me which first, this, and second you can tell this. Okay? Yes. 8 to 12 year is primordial. Yes, correct. Now you got the point. You may think this is a simple topic. You don't believe. In the exam I had a confusion. I dropped negative marking. I dropped the wrong answer and came. Okay? In the NORCET 6. You don't believe that. Okay? You may think very simple topic, but these are very high yield topics where you can score good marks. Easily you can score marks and come. Okay? Like that. You may feel some confusion somewhere. You will be having a confusion between primordial, where they may put the question primordial and primary. Anyone face the issue like this? Like I faced? Anyone? Any students like that? Coming on to the 18 to 24, you can see that is primary, because they are more vulnerable than this. So now it is primary prevention. Okay? Yes. Anyone can tell, anyone have faced this issue? Like myself? Okay. No smoking campaigns for children. Already I have told. School diet policies. Yes, to prevent malnutrition also. In early preschooler stage itself, like schooler stage itself, in the early schooling. Okay. Monitoring BP to prevent hypertension. This is a valid point here. Screening of hypertension comes under primary prevention. Okay. Monitoring of blood pressure. Okay. Monitoring of blood pressure to prevent hypertension comes under which condition? Okay. Come on, tell me. Yes, everyone will have. Okay. Come on. Anyone face that issue? Target is mainly non-communicable diseases. Like non-communicable diseases, what are they? Like smoking causes lung cancer, risk factor. Liver cirrhosis, we can say. Then major condition in India, that is hypertension, diabetes mellitus, and heart diseases. Okay, these are some important things you should note. Okay, yes. Then here I want to discuss a topic. Is it clear for you all? In BP monitoring, monitoring of BP in the early adulthood to find out the disease, these are future possibilities, then it comes under primary prevention. If it is secondary prevention, you are diagnosing a disease, like these patients having a symptoms of hypertension, they have not checked it. Now you are going to screen the patient with monitoring the BP, then it comes under secondary prevention. These people having a risk factor, 100% of risk factor, then you are going to screen, that is primary prevention. In BP screening itself, you are getting confusion here. Okay, BP screening you can take. I will explain you clearly. Now your doubts will be cleared. Okay, BP screening. Okay, with no risk factor. With no risk factor. RF is risk factor. With risk factor. With risk factor and symptoms arise. Symptoms present plus BP screening done. Then it is, now it is primordial. Here it is primary. Why? Because these patients, okay, with risk factor in a family, they are having BP, that is hypertension. So in the family, all other members also has lot of chances, more than 50% of chances they may get this hypertension condition, that is non-communicable disease condition. So that it is primary prevention. Specifically we are going to check BP. Okay, it is not like random screening. Okay, yes. Then here comes symptoms present, then we are going to monitor BP, then it is secondary prevention. So regular follow-up also will be there. Okay, follow-up checkups also comes under secondary prevention. Okay, now here comes the confusion. Okay, follow-up sense, follow-up comes under tertiary prevention. Okay, with organ damage is there. Okay, if there are any organ damage, then we are going to monitor BP for patients who is diagnosed with hypertension, tablet is started, some other complications like you can say complications of hypertension, you can say heart disease, stroke, paralysis, that is hemorrhagic stroke also we can say. Okay, if there are any conditions they have given, follow-up BP you are checking, then it is tertiary prevention. Okay, secondary prevention, symptoms arise, only for screening we are going to do, whether the patient is having BP or not. Follow-up comes under tertiary prevention. Okay, is it clear? Now with BP, only BP monitoring, you are getting 4 types of prevention from here itself. BP monitoring, there are high chances you may get this question in your NORCET. Okay, I am sure, so that you can focus. If you want, I will explain again so that your confusions will be cleared. Okay, yes. Sorry. Shall I tell you once again, or let us move to the next? Anyone can tell? Is it clear, children? Yes, correct. Everyone is correct. Like Swati, Sirisha, come on, welcome to the session. Sirisha, Rajadurai, you are the regular students, you are coming. Yes. From BP monitoring, you are getting 4 types of prevention here. Okay. Yes. That's what I am trying to explain you people. Is it clear? Okay. Let me give a quick recap. Okay. BP prevention, okay, BP screening we are going to do with no risk factor. If you are assessing, then it is primordial prevention. Okay, that is primordial prevention. With risk factor, if you are going to do, that is primary prevention. If some sort of symptoms related to hypertension, okay, some sort of symptoms related to hypertension like fatigue, headache, blurring of vision, tachycardia, okay, respiratory distress, any symptoms related to hypertension it is coming, then we can say that is secondary prevention, screening. We follow up with complications of the disease. Only we are going to do rehabilitative measures like follow-up we are going to do to stop the progress of the disease. Like progress of the disease condition in the sense, we are going to stop the chain of disease. Okay, for follow-up, further complications can be prevented. That is comes under tertiary prevention. Okay, yes. Mainly non-communicable diseases, that is primordial prevention. This is clear. Then comes to the primary prevention. What the exact definition? Prevent onset of disease by controlling risk factor. Prevent the onset of the disease. Okay, with risk factor present, no disease here. This is the keyword here. In primordial, no risk factor, no disease. But in primary you can say with risk factor. Yes to risk factor. And what may be the health promotion? Interventions are health promotion and specific protection. Health promotion we can say that is health education on hand hygiene. Because hand hygiene is the only thing, like hand hygiene is given to mass population, to all population. Okay, then coming on to this sanitation we can do. Okay, awareness programs. Okay, health promotion in the sense we are promoting the health of the particular community, particular group of people. We are going to promote the health, like health education programs where with specific condition we have diagnosed, the risk factors are identified. Hand hygiene to whom we are going to give? For the children. Children, they are prone to get lot of disease conditions, lot of infections related to hand hygiene. If the hand hygiene, if they are not doing good, then it is going to end up with the disease. If dental caries, we are going to do one video assisted teaching, effectiveness of video assisted teaching related to the dental caries, we are going to give for the children. So then it is health promotion activity. Okay, coming on to the specific protection, specifically particular disease we are going to give. Okay, coming on to this Specific protection, vaccination we can say. Vaccination we can say. And wearing helmet. Okay, health promotion serves the community, but specific protection serves the community as well as the individual aspect. Vaccination also prevents the disease condition as well as it is to the all people. Individually we are going to give. Specifically we are going to give measles vaccines we are going to give. Specifically it is going to protect from measles. Coming on to the helmets, helmet wearing is we are going to give for mass people, but individually it is going to prevent head injury. For the safety purpose we are going to give, creating an awareness as well as we are going to prevent this head injury also. Okay, is it clear? Vaccination is a primary prevention. Vaccination is a primary prevention, comes under specific protection. Don't confuse. We are going to give intervention there. In primordial prevention, no interventions we are going to give. Okay, vaccination always comes under primary prevention. One important thing, that is specific protection. This thing you will not learn, but now you should learn. Okay, under primary prevention we are having health promotion and specific protection. Okay, this is very high yield thing, very important, where you will be getting in MCQs. Where you will be getting this MCQs, health promotion and specific protection. Is that clear? Sirisha, that's what I am explaining. Vaccination is under primary prevention. Okay, yes. How you are telling that it is primordial prevention? So at birth we are giving BCG vaccine. The risk factor is identified, right? Newborn babies are prone to get this tuberculosis in future also. Risk factor is identified. 100%, that is more than 50% chances to get this infection, tuberculosis, attack of tuberculosis. Then we are going to give immunization, that is vaccine we are going to give to prevent the infection. For that you can say that is primary prevention. If there is no risk factor is identified, then it is primordial prevention. Okay, immunization comes under primary prevention. Specific protection, wearing helmets, specific protection. Okay, chlorination of water, health promotion. Okay, hey, vitamin A prophylaxis, specific protection. Contraception, specific protection. Okay, yes, to prevent unwanted pregnancies particularly we are going to give. Okay, yes. Is it clear for you all? Yes. Secondary prevention, early diagnosis and prompt treatment to halt progression. Diabetes mellitus is diagnosed with the help of urine test. Usually in community setup, which test will be using for urine testing? Two tests will be using. What are the name? You just tell the solutions. What are the two for diabetes mellitus and hypertension? Yes, PPE also for specific protection. Correct. Bipolar disorder. Correct. Can you please mention your name, if it is okay? Coming on to this, after the disease onset but in early stage. Okay, yes. Benetic and acetic acid. Yes, benetic solutions for diagnosing diabetes mellitus. Acetic acid, like whitey cloud appearance, ring like precipitate will be formed. That is for hypertension. Color wise changes, if it is brick red or it is green or it is blue, then we will categorize, that is for diabetes mellitus. If it is grade 1, only green color is there, then we can say that is stage 1. We can, if the age group is correct, okay, if the age group is between 30 to 35 years, then no symptoms, then the disease is diagnosed, then prompt the treatment like health lifestyle modification, like that we can say that will be secondary prevention. Okay, diagnosing and giving the intervention to halt the disease progression, then it is secondary prevention. Coming on to this intervention, screening, early treatment, pap smear will comes under to diagnose, to screen pap smear for cervical cancer, then it is secondary prevention. Early treatment, okay, and isolation will comes under this. In COVID-19, if the person is infected, then we are going to give isolation. Okay, that is secondary prevention, where no only minimal intervention, not like heavy intervention we are not going to, higher end intervention we are not going to do. Only for infectious diseases, isolation comes under secondary prevention. Okay, yes. Coming on to this, other examples, pap smear, mammography, BP monitoring, already I have discussed, colposcopy, and DOTS therapy for TB. DOTS therapy also comes under this secondary prevention to halt the progress of disease. Don't confuse here. If there we are going to do any intervention, okay, unless in primary prevention we are giving only vaccination and health promotion activity and specific protection activity. If we are going to do any intervention to the people, any intervention to the that is for the patients, then it will comes under secondary prevention. Is it clear? Yes. MDT also. Okay. Multi-drug therapy also will comes under this secondary prevention. Coming on to the tertiary prevention. Tertiary prevention reduce disability and improve quality of life. To improve the rehabilitative measures, simply you just remember rehabilitative measures. After the disease has advanced, late stages. Okay, yes. Disability limitation, rehabilitation, palliative care. Palliative care, other name we can say, that is end of life care. End of life care. Another one name we can say, that is terminal care. Okay, another one name is terminal care. Okay, yes. Then coming on to the example, physiotherapy, post-stroke, prosthetics, clutch walking, vocational training, or spice care. Okay, these are some examples of what? Tertiary prevention. Okay, yes. Till now we have seen about the primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Is that clear? Is that clear? Don't confuse here. BP monitoring already I have discussed. Okay, don't confuse between the interventions of levels of prevention. With intervention, if you are going to give minimal intervention, earlyly diagnosing and giving small intervention, then it will comes under secondary prevention. Most intervention if you are going to do, like cancer staging is done, then we are going to start the treatment. Okay, then we are going to start the treatment. If it is in stage 1, it is okay. If it is progress to stage 3 or stage 4, only we are going to do tertiary care. Okay, tertiary prevention we are going to do only for supporting the life, that is palliative care we can give. Okay, consider one question I will ask. Consider an cancer patient of CA breast. She is treated for 1 year, like chemoprophylaxis has started, like adjuvant therapy, neoadjuvant therapy has started, surgery is over. After that she is started with like what to say, vincristine, everything has been started, like chemoprophylaxis. We can include radiation therapy as well as med-onco. 2 things we have started, medical devices, medical thing also started, and radiation is also started for the patient. After 1 or 2 years, she is reported again to the physician, then it is diagnosed the cancer, it metastated. Now what type of prevention we are going to give. What type of prevention we are going to give. Okay. Okay, come on, tell me. Chemotherapy is started, right? Chemotherapy plus radiation therapy is started after 1 year. If the scenario is like that, after 1 year, she is reported with metastasis. Now, what type of prevention we can give? Okay. She is advised for palliative care. Okay, she is advised for palliative care. Then which mode of prevention it will be? Now it is easy, I have given the clue. I hope you will answer. It is tertiary prevention. It's easy, right? Like this only your questions will be, mostly you will be getting a question from primordial prevention and primary prevention. And they may focus on BP monitoring, because BP screening and monitoring can be linked with 4 types of prevention. It is interlinked, so that we cannot able to predict. So that I have given you this splitting of BP monitoring, how and all it can be asked. Okay, if stroke patients are admitted, follow-up BP is measured, then it will be tertiary prevention. Okay, yes. Okay, is it clear? Yes. Okay, correct. Priyanka, Devi, Sirisha, Arogya Mandir, Raipura, yes. Aniruddha, all correct. Why it is secondary prevention? No, Swati, it is wrong. Already I have told you na. Okay, I will explain you. A patient is diagnosed with cancer. So like that the scenario will be diagnosed with cancer, started chemotherapy and radiation therapy, and the disease progressed, metastasis reported, and doctor referred for palliative care. So what type of prevention is this? Now it is diagnosed, it is treated previously, and chemotherapy is also started. If it is only diagnosed, then it will be secondary prevention. Okay, because diagnostic intervention is done, then it is secondary prevention. We are going to halt the disease progression. While we are starting chemotherapy, we are going to stop the disease progression. Then it is metastasized and doctor referred for palliative care. Palliative care is different. Palliative care is end of life care, where if we do the intervention also, the disease will not get stopped. The disease condition will progress. Okay, the patient will be going to die soon. Okay, then in the sense we will be, palliative care will comes under tertiary prevention only. Okay, yes. Coming on to this immunity. Is it clear? We will start immunity now. Yes, children, come on. Okay. What is immunity? In your own language, you can say, if we have immunity, we will not get disease. If we have immunity, we will not get any infection. We will be very strong. Okay. Okay. The brands will promote, right? Like all the health drink properties, health drink products which we are available in the market tells us it is having this immunity. You can drink this. It is having vitamins and minerals, everything. If you consume this, you will be having good amount of immunity to fight against the infection. Even with some sort of soaps also we are having immunity. Okay, immunity will have. Okay, yes. Protects against pathogens, bacteria, virus, and etc. That is immunity. Okay, we are having types of immunity. We will explain where high yield of MCQ can be asked from that. Okay, so this is also very important MCQ. Today I have taken which I felt difficulty. Though it looks easy, I felt confusion and difficulty during attending the exams, where I lost 2 marks from these 2 topics. I took this topic. Okay, yes. So what mistake I did, you people should not do that. For that purpose, I came up with this topic. Okay, though it is easy, please have a keen attention towards that. Mainly we are having 2 types of immunity. That is innate immunity and acquired immunity or adaptive immunity. Okay, innate immunity from the birth, right? It is present from birth. Natural. Don't confuse with innate and natural. Natural, innate immunity. Okay, present from birth. This adaptive or acquired immunity developed after the exposure. In acquired immunity, we are having types. Acquired immunity. We are having types, that is, what are they? Come on, that is, anyone? I have written half. Now I have given the clue, you will answer. Active and yes, Devi correct. First preference we have answered. Active and passive. Coming on to the active, I am going to divide into two. In active, you can say natural, artificial. In passive, that is natural, artificial. Come on, I will tell the examples. After exposure to a disease, after exposure, antibodies are developed against the antigen. That is acquired active natural immunity. Simply if they ask innate natural immunity, innate, if the word innate natural immunity, then it is from birth. Don't confuse between these two. Acquired or adaptive active natural immunity, it is from antibodies. If it is artificial, through vaccination. With the help of vaccination, antibodies are formed against the antigen. Okay, example BCG, every vaccines, TT, you can say. Okay, it is clear? Yes. Coming on to the acquired passive natural. Acquired passive natural, how we can say that is from mother to fetus. Mother to fetus. It is transferred from maternal to fetus. Okay, the antibodies are transferred against a specific antigen. Okay, specific condition. Coming on to the acquired passive artificial, it is anti-serum immunoglobulins transfusion, anti-serum. Okay, anti-serum or immunoglobulins transfusion, external, from outside we are giving inside. Okay, it is transferred. Okay, that is acquired passive artificial. Don't confuse. Okay, I will repeat again. We are having acquired immunity, we are having specifically two types, that is active and passive. In active we are having natural and artificial. In passive we are having natural and artificial. And examples are, for natural active, it is through the, when we are exposed to an infection, antibodies are formed against the antigen, that is active natural. If it is artificial, through vaccination. If it is passive, okay, it is having natural and artificial. Acquired passive natural is from mother to fetus. Acquired passive artificial from what? Antibodies and anti-serum, that is anti-serum. Okay, yes, mother's milk, correct. Is it clear? This is immunity. Hope we have completed, right? No, we will be discussing in detail. Where are the MCQ points? This everyone can, you may be aware of it. You have learned from the basics like BSc nursing. We have learned this from the first year, right? But while attending the MCQs, you will be having confusion. That is the major point here. I am taking this topic. Okay, yes. Innate immunity, first line of defense, that is the key word. Innate or natural. Okay, first line of defense, that is the keyword. Please make a note. It is non-specific response present at birth. It is fast acting hours. Examples: skin, mucosa and phagocytes. Skin, mucosa and phagocytes. That is innate immunity, first line of defense. Okay, yes. Coming on to the acquired immunity, that is antigen specific. It is non-specific. It will not be depends upon the antigen. If without antigen, it is giving some sort of response, then it is innate immunity. That is first line of defense. Okay, some antigen is coming, against that particular antigen, the antibody is not formed. Okay, it is a fast acting. For example, urticaria. You can say urticaria, some allergies. Without knowing anything, we cannot able to diagnose, but initially first it will give some reactions. That is innate immunity. Okay, from the birth. Against an individual will differ from individual from this. Okay, don't confuse here. Then coming on to this acquired, develops after exposure. You're exposed to an infection. Come on, you can say a common cold. Okay, common cold, you are exposed, certainly will not get that infection. After 2 or 3 days you will be getting the common cold. Then against that the antibodies are formed, even though if you are not taking any antibiotics, but within 1 week it will get subsided, because against the infection, the antigen, the antibodies are formed and it is destroying, and against that the antibodies are developed, the immunity is developed there. Okay, yes, yes. Active natural after chicken pox. Correct. Slower onset days is as memory, but innate immunity doesn't have memory. Involves B and T cell lymphocytes. Okay, yes. These are some I healed content where they may focus MCQs. Okay, major thing, from memory they may ask you the question, from duration they may ask the question. Let me explain. If the receptors, they are broad, non-specific, already I have told, but it is specific, highly specific. Coming on to it is TB mentioned, T cell and B cell lymphocytes. These are memory cells. Against this, antibodies are formed against the antigen. Response time, it is hours to days, but it is days to weeks. Within hours to days, it will, the reaction is happened, but it may takes days to week. Okay, the memory is absent in innate immunity, but memory it has. Again, you will not get chicken pox if the antibodies are formed, if the stains are different. Okay, for COVID-19 we can say if the immune is good, we will not get, but if the gene is changed, if the mode of the infection is changed, okay, you can say the variance of COVID-19 is there. If we get another variants like omega variants we are having, right, if it is there, then we will get that infection, because the variant is different. Against that, our body did not recognize or develop the antibodies. Only for specific type it is developed. Okay, you can say COVID-19 we are having a that is SARS virus, COVID virus, we are having type 1 and type 2. We got type 1 in this month. Okay, then antibodies will formed against that antigens. Then next month or 2 months later, if we are getting this type 2, we will get the infection or not? Definitely we are going to get that infection. If again the type 1, if you are exposed to the patient who are got this COVID-19 type 1 virus type 1 virus infection, we will not get that infection, because last month only I got the infection and immune will be developed against that. Okay, if the immune is not developed, then we are going to get that infection again. That's what this innate and adaptive immunity tells us. Okay, coming on to this duration, it is short duration. Innate immunity will be short duration. Long term, that is adaptive immunity, because from months to years you will not get that specific infection in a particular period of time, unless the type and genes are changed. Okay, yes. Is it clear? In that you can say the receptors, response time, I healed content, that is memory and duration, whether innate immunity has memory or not. Okay, that is your MCQ point. Focus on this MCQ point, have a note. Okay, yes. Coming on to this, already I have discussed what is active and passive immunity. Let me give a quick review. Active natural. Active natural where the infection is attained, then the antibodies are formed, that is active natural. Okay, coming on to this, active artificial, where with vaccines. Okay, coming on to this next, passive natural, it is maternal, that is IgG, good immunoglobulins will cross placenta, IgA milk, maternal thing. Then passive artificial is always Ig injections and antiserum, that is immunoglobulin injections and antiserum. Okay, yes. Coming on to this, humoral versus cell mediated immunity. Humorals will have, which makes the antibodies, B cells and T cells, right? This humoral B cells will make the antibodies, which acts in the body fluids like blood and lymph nodes. Example, IgG, IgA and Ig. Coming on to the cell mediator, which is against a specific viruses and bacteria, that is CD4. In HIV, okay, in AIDS, we will take this CD4 and CD8 counts. For example, in cancer, specific T cell markers like leukemia, we will take this CD8, that is CD8 count, CD33, like we are having markers. Flow cytometry, we will be doing a particular test. In that, this CD8 T helper cells counts, T cell counts we will be checking. Okay, the titers we will be checking whether it is positive or not. Okay, that is cell mediated immunity, where no antibodies will be formed against this. Only with this you can able to identify that is the patient is having this type of infection. Okay, like that, and acts on infected cells. If it is developed cell mediated, it is acts only on viruses and TB, invading, that is invading microorganism or invading virus. It will act against the infected cells, that is humoral B cells and T cells. T cell is cell mediated, humorous B cell, and which makes antibodies, that is B cells. Which do not make antibodies, that is T cell. Okay, yes, it is acts on body fluids, that is blood and lymph nodes. Okay, which acts on virus, that is T cell. Don't confuse here, because sometimes reasoning and assertion question they may focus. Okay, yes, it is clear, or you want me to explain again? Children, come on, tell me. Anyone? If you want me to explain again, I will tell a quick review, or else we'll move to the next. Okay, yes. Coming on to this immunoglobulin classes, from this you may get some of the important questions, right? Yes. IgA, K, presence on secretions like breast milk, tears, saliva, milk, mucosal protection, it is doing, that is IgA, which will circulate on blood and lymph nodes. Okay, IgG, it is most abundant, crosses placenta. IgG, good and long term immunity it is providing, that is IgG. Okay, IgM, which is the first antibody response, okay, formed in an infection. This is your MCQ point. Okay, yes. IgE, allergic reaction, it is the first one, and parasitic infections. In differential counts, we will be for infection, if any anaphylactic reactions of any other allergic reaction is there, like allergic infection is there, which will be there, like basophils or eosinophils, like you can say WBC count is increased, right? You can say basophils, eosinophils, and RBC you can say. Okay, you can say whether which will be increased in allergic reactions, eosinophils or basophils, or neutrophils you can say, neutrophils and lymphocytes. Neutrophils, lymphocytes, which will be increased? Come on, tell me. If there is an allergic reaction, which will be increased? Basophils, eosinophils, neutrophils and lymphocytes, which will be increased in WBC. WBC cells are increased already. Okay, Come on, tell me. You are going to answer. No one is going to answer. Yes. So it is eosinophils. Okay, if there are any allergic reaction, eosinoph counts will be there. That is more than 0.6. Okay, it will be there. So if IgE is the, if which in allergic reaction, which immunoglobulins will be released? That is IgE. Coming on to this IgD, which helps in B cell activation. B cell is responsible for what? Humoral immunity, which is responsible for producing antibodies. So this immunoglobulin is important in activation of this B cells to produce antibodies, and function not well. Okay, it is no other function it is there, only this B cell will activation is helps for this IgD. IgD helps in activation of this B cell. Okay, antibodies are formed against it. Okay, yes. Neutrophils, once the infection is high, if the infection is high, neutrophils will get reduced. Okay, if the infection rate is high, if it is immunocompromised, then the neutrophils will be get decreased. If the child or patient is diagnosed with cancer, then there will be a increased neutrophils count will be there sometimes, because in WBC, first stage of leukemia, first stage, there will be increased neutrophils count will be there. Okay, neutrophils will be increased. Neutrophils and lymphocytes count will be increased. Okay, yes. Coming on to this next, is it clear? IgD, IgE, IgM, IgG and IgA. What is the first response antibody? That is IgM. Which is crossing the placenta? IgG. Which present in breast milk? IgA. Okay, yes. Is it clear? Now we are going to discuss MCQs. Okay, following traditional lifestyles for prevention of coronary artery disease is which level of prevention? Following traditional lifestyles they are telling. Okay, okay, whether the risk category. Ankita, the audio quality is good from my side because I am checking from my phone. Okay, for that only I am checking in my phone. It is good. Kindly check your internet connection as well as you can use your headphones. Okay, yes. Coming on to this MCQ, it is primary prevention, secondary, primordial and tertiary. Quick, because already I have told lot of explanation I have given. From this only I am going to assess whether my class is good or not. Okay, yes. Come on, tell me. Come on, children. Yes. Yeah. So here, traditional lifestyles, they have given a keyword here. If it is for geriatrics or for obese people, if there is a term for for obese people for prevention of coronary artery disease, we are going to give an health education program. Which level of prevention it will be? Then it is primary prevention. But what is the option here? What is the option they have given? Okay, the keyword tells us traditional lifestyle changes. They have not given the risk factors. Okay, no risk factor, vulnerable population they have not identified here. No vulnerable population. Then it will be primordial prevention. Okay, Coronary, they have not, see, don't give D and all, okay? D and all will not come. How I will tell? Because coronary artery disease is the condition, okay? They have not given this population is affected. This patient has got coronary artery disease. If the patient got coronary artery disease, then you are going to give an intervention or give a health education. That will be tertiary prevention. Following traditional lifestyles. Traditional lifestyle in the sense, particularly you are going to approach a community where no risk factors are identified. For example, a World Heart Day is celebrated. We are going to give an intervention like health education activity towards the population, towards the community people. Then no risk factors identified, irrespective of age group, irrespective of the gender. We are going to create an awareness program. Generally, audience, we are going to give what are the risk factors for this coronary artery disease. Then that will be primordial prevention only. Okay, if risk category is identified, like dental caries, I have told you, no, 8 to 12 years old students, that is children, are high prone to get this dental caries. Then it will be primary prevention because the risk category is identified. For dental caries, from the pediatrics, like you can say schooler people from the age of 4 years or 5 years, that is first standard children or second standard children, if we are going to give an awareness program, then it will be primordial prevention, because in future there is chances. Okay, that is, you should remember, it is primordial prevention. Don't tell primary, then only I am telling traditional lifestyles. Lifestyle modification always comes under primordial prevention, irrespective of risk factors. Okay, don't confuse here. If you want to tell me, I will explain again. Okay, don't confuse here. The answer will be primordial prevention. Okay, primordial prevention. Okay, yes, don't confuse children. If it is risk category they have given, risk population they have given, then it will be primary prevention. If no risk category, no risk population is given, see the difference. Risk category is different, right? Risk category, the condition they have given, that is risk factor responsible. Risk population is people, female gender. Okay, for example, I will tell you a beautiful example which from our topic itself, like menopause we have discussed, right? Menopause we have discussed. In that menopause, what is the highest chances? Menopausal women are high prone to get coronary artery disease due to estrogen deficit. Okay, due to that, due to hormonal changes, there are chances. We are going to create an health education programs to prevent heart disease. What type of prevention is this? For menopausal women, we are going to give an health education program on lifestyle modification. We are going to give an health education program to prevent coronary artery disease. What type of prevention it is? What type of prevention it is? Come on, tell me. After that, you can say disability limitation is included in which level of prevention. It is easy. You will tell. Okay, correct. This is correct. But tell me, what is the question I have discussed now? What is the question I have told? Menopausal woman. Menopause woman. We are going to conduct what? Health education in prevention of what? Coronary artery disease. What may be the prevention, level of prevention? What may be the level of prevention? Come on, tell me. Yes, it is primary prevention. Okay, yes. Coming on to this psychotherapy. Okay, yes. Psychotherapy is an example of which level of prevention? Yes, correct. Everyone is correct. Devi, Priyanka, Arogya Mandir, Raipura. You are correct. Yes. Coming on to this next question. Okay. Psychotherapy is an example of which level of prevention? It is primordial, primary, secondary and tertiary. The options are easy. Question is also looking easy, but you are going to tell the answer. Yes. How it is tertiary prevention? Come on, anyone tell me. How is it tertiary? The answer is correct. How you are telling it is tertiary? Yes, correct. Because psychotherapy only for specific conditions like bipolar disorder, schizophrenia, we are going to give this psychotherapy, right? It is diagnosed already to stop the progress of the disease, to rehabilitate. Already it is progressed and has some like behavioral changes is done. Okay, behavioral abnormality is done. Then we are going to rehabilitate. We are going to the quality of life of the patient should be improved. So for that we are giving this psychotherapy to outcome, to get out of the condition, also to improve the quality of life. We are going to give this psychotherapy. For that tertiary prevention is there. Okay, yes. Next question. Screening of disease falls under which level of prevention? Screening of disease. Come on, tell me. Yes, correct. Screening of diseases falls under which level of prevention? Screening always comes under yes, correct. Sirisha, you are correct. Already patient diagnosed, correct. No, it is not B. Okay, I will tell. Screening, in the sense, we are suspecting a disease condition to a particular individual. Okay, we are suspecting. Okay, then if we are doing an intervention like pap smear, for example, post-menopausal woman, we are going to do pap smear. Reproductive age woman under the age of post reproductive age, that is 38 to 45 or 45 to 55 post-menopause woman or pre-menstrual menopausal woman, we are going to do pap smear for the screening of cervical cancer. Okay, then it comes under secondary prevention only, because we are screening and diagnose and halt the disease. Okay, small therapy has been started. Okay, if TB is diagnosed, then we are going to start DOTS therapy. Okay, then it is secondary prevention. It will not be a primary prevention. Primary prevention will stop at health promotion and specific protection itself. Okay, protection only it is going to give. After the disease arrived, then it is given the hands to secondary prevention. Okay, yes, correct. Devi, you are correct. Always. Devi is correct always, right? Sirisha also correct. Yes, everyone is correct. Ramya is also. Ramya, you have changed the option, you are correct. Now you understood, right? Now you got the point. Health promotion is classified under which level of prevention? Health promotion will comes under which level of prevention? Now it is very easy for you all. I hope you will not make the mistake. Come on, tell me. Health promotion is classified under which level of prevention? Yes, it is primary prevention. Yes, you are all correct. Now you got the point, right? If there are any term related to specific protection also, we can say that is primary prevention. Okay, just give you a minute. Sorry for the interruption. Now we are going to see the next question. Preventive action taken before disease onset belongs to which level? Preventive action taken before disease onset belongs to which level? Disease onset they have told, okay. They have not talked about risk factor is present or not, but straightly they have given disease onset. Then it will be now you are having a confusion, right? Preventive action, they have told action, disease onset. Preventive action they are taking, they have not, it is not a long term. They have preventive action in the sense they have identified the risk factor population. Risk factor, don't confuse your children. Preventive action in the sense they are not talking about the risk factor, but already they have diagnosed the risk, identified the risk factor population. Then we are going to give only a specific disease condition. If the term diseases or any other specific term they have given related to the risk factor, then we can say that is primordial prevention. Now the answer will be primary prevention, okay. The answer will be primary prevention, not secondary prevention. Action they have taken means in the sense before the onset of the disease. Secondary prevention, screening and diagnosing a disease, okay. Screening and diagnosing a disease. Action they have told, preventive action taken before disease onset belongs to which level? Preventive action is taken belongs to disease onset, that is primary prevention, okay. Yes, primary prevention only. Yes, yes, it is primary prevention. Now you can see the answer. Primary prevention aims to prevent disease before it occurs by addressing the risk factor or providing specific protection, okay. Particularly we are protecting specific protection to a disease condition to prevent, okay. Health education on coronary artery disease on what population? Obese population. Population, they are vulnerable to get coronary artery disease. For example, I will tell like obese patients also can get diabetes mellitus, hypertension also, right? In that they have mentioned risk factor plus action, then particularly they are going to diagnose or prevent a disease, then it comes under primary prevention, okay. Yes, correct. Early diagnosis and treatment are components of which level? Early diagnosis and treatment. Risk factor diagnosis, risk factor is identified, diagnosis done and treatment is started, then it comes under early diagnosis and treatment started. Yes, it is secondary prevention. Why Rajkumari, Rajadurai, you have told primary, okay. Why you have told primary? Primary will not be there. Already I have told you diagnosis done, screening is done, okay. Screening is done, then treatment is started. That is, if intervention is more, only vaccination will comes under primary. Other than that, we are not going to do any intervention to the population or patients, okay. Then it will be secondary only, early diagnosis and treatment, okay. Yes, coming on to this, preventing the emergence of risk factor is classified as preventing the emergence of risk factor. Now you tell, this question may be challenging for you. I hope from my side I am challenging because I got quite confused while developing this MCQ, okay. Come on, tell me, anyone? Maybe you will be getting some confusion from this question. Preventing the emergence of risk factor is classified as Moonchild. Why it is primary prevention? Already they have given emergence before arising the risk factor, we are going to identify, we are going to prevent the disease. Then it will be primordial prevention. Then it will be primordial prevention only. Okay? Yes. Is it clear? No, why again A? Okay. Again I will explain. Don't worry. We are having only from this there is chance of getting you questions. Primary and primordial. Okay? Primordial. What are the key difference I told? In primary, risk factor is identified. Risk factor identified. Here in primordial, no risk factor. In that, population is defined. Population defined. Defined population, specific population we are going to give. Defined and specific population. And here, no population is defined. No population is defined. Okay? Here, health promotion is done without risk factor. Okay, with risk factor, sorry, with risk factor, health promotion and specific protection we are doing, but only health education we are going to do, like health lifestyle modification, we are going to do. Okay, health education. Okay, for example, for prevention of malaria, we are going to one rural area which is prone to get this type of routine malarial infection to a particular community. Okay, endemic population is there. We are going to give a health education program. Seasonally the disease is coming. Okay, seasonally malaria is coming to the particular area alone. Now we are going to give an health education program. Now tell me what type of prevention it is. Primary prevention or primordial prevention? Okay, come on, tell me now. Now your doubts will be cleared. Come on, tell me. No, Rajkumari Rajadurai, it is not primordial prevention, because every year, I told, every year they are getting malarial infection in a particular community. Okay, already the risk is identified. So we are going to do preventive measures for a particular community. Then it is primary prevention. If it is primordial prevention, what we will be doing? Irrespective of community, irrespective of the society, we are going to give an awareness program generally to a population on prevention of malaria, like giving advertisement in the television, giving awareness posters around all over the town or city. Then it will be primordial prevention, like irrespective of age, irrespective of community, irrespective of gender, we are going to give an awareness program on regarding lifestyle modification and traditional practices. Then it will be primordial prevention. If there any risk category is mentioned, any population is defined population and undefined population. Defined population are more vulnerable than undefined population. That's the point you should remember. Okay? Yes. Is it clear? Shall we move? Yes, it is primary. You are correct. Yes. School health checkup comes under which level of prevention? School health checkup. Okay? School health children, in future, they are going to get some sort of disease. They have not mentioned any disease condition. Okay, they have mentioned only school going children, we are going to do a screening. Okay, during our school and all, we were supposed to be screened, right? They will be screening weight. Okay, they will be screening for immunization schedule and all. They will be screening for us. Okay, in that what may be? No. Swati, okay, correct. Devi, why you're telling is secondary prevention? School health checkups checkup only we are going to do. We are not going to screen anything for disease condition. Okay, they have not mentioned for malnutrition. If they mention the term for school children, specifically for malnutrition, screening is done like MUSC or triceps fold thickness, like weight, BMI, then it will be secondary prevention. School health checkups like vitals, we are not going to identify any disease condition. Okay, any disease condition. Okay, then it will be primordial prevention. School health checkups comes under which level of prevention? Okay, it is primordial prevention. Why it is? School health checkups aim at early identification of a risk factor. We are going to identify the risk factor. Okay, if the child is malnourished, undernutrition, underweight, then we are going to do again another screening, like protein loss is there or not. Then it will be shifted to secondary prevention, no primary prevention. Okay, future there may be a chances. Okay, like health education activity, health checkup also comes under, right? Yes. Unhealthy behaviors part of primordial prevention. Like unhealthy behaviors, we can say, like in future you should not smoke, you should not consume alcohol, like another abuse activities also we can say. Okay, in future, like they may be get addicted towards the drug. In that, from foundation, from the basic, if we are going to create an awareness, then it will be primordial prevention. Okay, irrespective of risk factor, no risk factor is identified. To identify the risk factor, that is primordial prevention. Okay, come on. If an health checkup is done for an adult regarding school health check, like BP checkup, then we can say that is primary prevention. Okay, screening is done, then it is secondary prevention. Okay, risk factor is identified, then we are going to do anything, then it is primary. Screening, already we are BP monitoring is done to identify risk factor is present also with some sort of symptoms, then it is secondary prevention. Okay, yes. Immunizing a child against measles is an example of which level of prevention? Don't confuse between primary and primordial. Don't confuse between primary and secondary. That is the major thing. Case finding is under secondary prevention. Case finding in the sense whether what we are going to give an intervention or not. If we are going to do any diagnostic procedure, then we can say for baseline vital signs we can say that is primordial or primary prevention under the risk factor. But screening, anything we are going to do like mammography, pap smear, X-ray, okay, if we are going to do specific tests, then specifically for particular condition we are going to do, that is comes under secondary prevention. Okay, specific protection and specific identification, that comes under secondary prevention. For health promotion and specific protection against a particular disease to a community, we are going to create an awareness, then it comes under primary. Don't confuse between primary and secondary. Okay, yes. Now you can say it is easy, immunization is always comes under primary prevention. Okay, yes. Screening is school checkup. So, Sirisha, I will tell, already I have told, screening, they have not mentioned about any condition here. Okay, school health checkups regarding dental caries. Okay, regarding dental caries. Dental caries or malnutrition. If they given any specific disease condition, then we can say that is primary, because this group are more prone to get malnutrition as well as dental caries. They have not, in this question, they have not given any condition. In previous question, They have not given the risk factor, but they have given the disease, a word called disease, particular disease. Okay, then it is also primordial prevention only. Here also it is primordial prevention only, because they have given the group of audience. Okay, school health, it may be from school going children from the age of 6 or 5 till 18 or 17 years, we can say they are school going children. School going health checkup will be done, right? But specifically if we are talking dental caries or malnutrition, then it will be primary prevention. Now you got the point. No condition is given, no population is defined for a particular condition. Link with, I will tell you again. Okay, if you are having a confusion, link with, okay, I will make a blue pen. Okay, link with, always link with population with condition, disease condition. Whether this population will get this condition or not, whether this population will get this condition or not, whether the population is defined or not defined. In that, this condition is mentioned. Okay, condition is defined, not defined. Okay, if the population is defined, then there is a risk for this condition. Then we are going to create an awareness, that is primary prevention. Okay, if the population is not defined, but in future there may be a condition, okay, the defined condition, there may be chance to get, okay, the population also not defined, the age group, gender, irrespective of everything, it is not defined. If in future there is possibility of this condition, then it is primordial prevention. Always link with population, whether the risk factor is defined or not. The risk factor is defined or not. If the risk factor, okay, in the condition, risk factor is defined or not defined, that also plays a vital role. If the risk factor is defined there and population also defined, then we are going to do a screen. We are going to do a partial screen. Not we are going to give an intervention like pap smear and all. Just we are going to create an awareness program. Then that will be primary prevention. Risk is defined, population is defined. Then we are going to give an health education. Then it will be what? Primary prevention. If population is not defined, risk factor is also not defined, but the condition is defined. Condition is defined, then it will be primordial prevention. Because what is the target is? To create awareness regarding this defined condition. For primordial prevention, we are going to create an awareness regarding the defined condition. Then we are going to do an awareness, that is primordial prevention. Okay, population is also not defined, risk factor is not defined, then the condition is defined. Okay, for example, dental caries, we are that is the condition. Irrespective of all the people, we are going to create an awareness regarding to the parents. Dental caries, for the complications of dental caries and effectiveness of dental hygiene we are going to give. We can give for the mother also, for the parents, so that it will create an impact to the target audience. Okay, we are now, for example, you can say 5 to 7 years childs are there in a school. If we create an awareness program also, they won't understand, but the population is not defined. In a public forum, in a public community, generally we are creating an awareness like advertisements, everything we are going to do. For irrespective of any other thing, students also will watch, school students also will watch, and parents also will watch, everybody will watch. So the awareness is getting all over the population, because irrespective of defined population, it is reaching all over the area. Then it will be what? Primordial prevention. The risk is not identified, the population is not defined, but Our aim is to create an awareness regarding dental hygiene. That is the concept. We have created the awareness through mass medias, through social medias, Instagram, Facebook, YouTube. We have uploaded a video. Okay. Considering now I am teaching you a concept. What is the target? To achieve MCQ correctly in NORCET. Okay, that is the concept. For what I am teaching, what is my target audience? You people, the aspirants are my target audience. Okay, I am reaching you. For a purpose I am doing. What is the defined population here? Only NORCET people are going to watch here. Other than that, no one is going to watch. Okay, population is defined. Class I am taking regarding levels of prevention. Now the target is to achieve NORCET. Everything is clear. Now it is to primarily I am preventing you. What? I am creating an awareness regarding NORCET questions, NORCET, how to approach the levels of prevention MCQ, and the concept is also clear for you. That is primary prevention. Okay. If I am creating an awareness video regarding negative marking in first year of BSc nursing students, okay, or in 10th standard or 11th standard students, future they may be going to choose nursing and also they may be approaching for NORCET. That is undefined population. Okay, sometimes it may be helpful, sometimes it not be helpful. So that comes under primordial prevention. Before that itself I am going to reduce now. You are going to approach next month. So you are primary prevention for me. First year or 12th or 10th standard students, if I am going to create an awareness, then it is primordial prevention. Okay? Yes. Health education is primary prevention. Yes. Generally, if they are given health education, it comes under primary prevention. If health education in the sense, what is actually doing? Health education, what is actually doing? Health education if population defined, okay, risk is defined, condition is defined, then it is primary prevention. Primary prevention. Next, if the population is not defined, risk factor is not defined, condition is defined, all are not defined, then generally we are going to give an health education. Then it is primordial prevention. Okay, is it clear? If risk factor is present and population is also present, if you can say if population is not there, risk factor is not there, okay, population is present, risk factor is not there, condition is present. Okay, to identify the risk factor for this particular population, to create an awareness regarding this condition also we are going to do. That also comes under primary prevention. To identify the risk factor also, if you are going to do, then it is primordial prevention only. Okay, then it is primordial prevention only. Okay, don't confuse here. Okay, to identify the risk factor also, then we are going to do this, that is primordial prevention. Okay, yes, okay, don't confuse here. Already I have told lot of explanation, please have the clarity. Okay, yes. Specific protection means belong to which level of prevention? It is easy, right? Yes, it is primary prevention. Okay, yes. Here comes the question. Pasteurization of the milk represents which level of prevention? Pasteurization of the milk will be which level of prevention? Oh. Yes, it is primary prevention. Okay, it is going to benefit irrespective of population, irrespective of the age group, it is going to benefit. But intervention we are doing, milk pasteurization is done. to prevent the disease conditions we have defined. Okay, disease condition is defined, the population is also defined, and risk factors, because every people will consume milk. I will also consume milk, a small infant also will consume milk, a small children like school age children, preschoolers, everybody will consume milk. Okay, the target audience is also defined, population is also defined, and risk factors, that is if pasteurization is not done, lot of milk associated infections will come. Okay, yes, that is primary prevention. Now you got the point, right? Yes. Which of the following is an example of passive natural immunity? Now we got the questions regarding immunity. Now we are going to discuss which example of passive natural immunity. Passive natural, come on, tell me. Vaccination, maternal antibodies transferred via placenta, infection with chickenpox, injection of tetanus, immunoglobulins. See, again I will tell, so for your easy remembrance, please, innate is different, innate is natural, okay. This is, after that, two major, that is acquired or adaptive. Two main types of immunity. In that, we are having acquired immunity, we are having two, that is natural, that is active, passive. In that we are having natural, artificial. Here also we are having natural, artificial. Quick, come on. Natural, from exposure to the disease we are getting antibodies. Acquired, vaccination. Acquired, passive, natural is from mother to the maternal transfer. Okay. Artificial is we are getting antiserum. Okay, we are getting antiserum. So the answer will be maternal antibodies transferred via placenta. That is the answer. Okay, yes. Is it clear for you all? Okay. Which immunoglobulin is first produced in response to an antigen? Which is produced first? First line of that is immunoglobulins will be present. Okay, first thing will be, come on, tell me. So I am having a confusion between IgG and IgM. So anyone can explain? Okay, IgM will be present, first line of response. IgG will cross placenta. What type of immunity does IgG give? It is acquired, passive, natural immunity. That is IgG. That is, you can say acquired, passive, natural immunity. APN, acquired, natural, that is acquired, natural immunity, passive. That is IgG will give. IgM is the first line response of antigen, okay, towards an invaders. Okay, yes. Innate immunity is characterized by which of the following features? Come on, tell me. Innate immunity, antigen specificity, presence of memory, immediate response, clonal expansion of lymphocytes. Okay, already we have discussed antigen specificity will not be there in what? Innate immunity. It is irrespective, no antigen specificity will be there. Presence of memory will be there for innate immunity. Presence of memory will not be there. Immediate response will be there, yes, within hours to days. Okay, clonal expansion of lymphocytes. Lymphocytes are done by this acquired immunity, so it will not be there. So answer will be immediate response to immediate response will be there irrespective of antigens. That is innate immunity will be there. First line of defense is always innate immunity. Okay, yes, correct. The concept, the content may be very simple. In NORCET, you have noted anything? So some students will be giving repeatedly NORCET. Some people will be in AIMS, some other AIMS also, they will give NORCET to get their updated, to get them updated. So if you note one thing, as per my knowledge, 50% of the question paper will be easy, where everyone can attend. In that 50%, they choose a very simple topic, and they may put you in confusion, where the question will be easy, the options also very easy. Only thing, you will be having a confusion. Only thing, in previous question, I got an confusion between IgG and IgM. Though I read the content, though I thought, but I had a confusion a small bit. In that situation, what suggestion I can give how to overcome situation? One thing, you can skip the question. Okay, first thing, you can skip the question, or else, sir, I want to attend the question definitely because I read the concept clearly. Only thing, I don't have the clarity. In that situation, what you can do? Come on, tell me. In that situation, what you can do, I will tell you a beautiful thing. Okay, you will be having a 18 minutes of time, right? In that, scenario based questions or some questions like numerical questions like drug calculation or image based question, if you are not going to attend, you just keep at last. The confusing questions are there. After attending all, you can spend 3 to 5 minutes regarding that question. If you definitely got the answer, put the option and come. If you till the end of the session, if you are not getting the answer, don't take risk, leave the question and come. Okay, every time leave the question and come, because negative marking will reduce your rank and mark as well as. Okay, don't attend the question. If you know in a particular session 10 questions is alone enough for you. You can get that in the upcoming sessions like session 2, session C, session 4 is there. You can get that question. Okay, don't attend. Okay, that is my humble suggestion. Okay, which of the following immunoglobulins is most abundant in human body? Human body most abundant, they are asking. Okay, that is IgG. Why? IgG constitute about 75% of circulating antibodies, because it is transferred from placenta, which crosses the placenta. Okay, what is actually do? It crosses the placenta and circulating in the human body. Okay, yes. Now comes the question. A full-term neonate born to a mother with rubella infection in the 3rd trimester is tested for rubella antibodies on day 2 of life. The test shows high IgG titers. IgG is increased. What does this most likely indicated? Neonatal rubella infection. Okay, full term neonate is there. Passive transfer of maternal IgG, active immune response of the neonate, contamination of the test sample. Okay, neonate rubella infection, passive transfer of maternal IgG, active immune response to a neonate, contamination of the test sample. Come on, tell me. Yes, good evening, Greeny. Why you're late? I was expecting you people. Those who people want the session, they will be attentive. Okay, like that, Greeny is also attentive. Why you are late? Yes, Nirmala Mary B. Yes, passive transfer of maternal IgG towards the neonate. Okay, if against that immunity is developed, then what type of immunity is this? Come on, tell me. A 6-year-old child receives a tetanus toxoid booster after stepping on a rusty rail. 2 weeks later, high level of IgG is detected in the serum. What type of immunity is this? 6-year-old child receives tetanus toxide. Vaccination. Only they have given the child received vaccination. Which type of infection is this? Scenario based they have given. In mains you can expect this question. Okay? Yes. Yes, yes. Okay, okay. Good, good, Greeny. Come on, good. You can watch this YouTube session. It is uploaded, right? You can watch. After when you feel free, you can watch. Come on, tell me. P. Vaccination. It's clearly given. 2 weeks later, high level of IgG are detected in serum. What type of immunity is this? Yes. It is active artificial. Acquired active artificial. Okay? Yes. Next question. A patient presents with recurrent respiratory and gastrointestinal infection. Serum immunoglobulin analysis shows decreased IgA levels. Which of the following complications is patient mostly risk for? Severe allergic reactions, mucosal infections, autoimmune hemolytic anemia, delayed wound healing. Don't tell artificial active. Always from the top you should remember. Acquired active artificial immunity. Like that if you remember, you won't have any confusion. Sometimes they may interchange the words and they may put you in confusion. Always remember with what is the immunity: innate immunity, acquired immunity. In acquired immunity we are having active passive. In active we are having natural artificial. In passive we are having natural artificial. Like that you just split up and you just remember. If you will not forget. Okay? Yes. Come on, tell me the answer. Okay, sorry, I have given the answer. IgA specifically will be in what? Will be in skin, mucosal area and milk also. Secretions. Mucosal secretions also in milk also. So IgA is present. It is due to mucosal infection. Yes. Yes, Greeny, you are correct. Yes. IgA provides protection at mucosal surfaces like GI, respiratory tracts. Deficiency leads to frequent mucosal infection. Okay? If you are having any respiratory tract infections like upper respiratory, lower respiratory, due to this IgA levels are down, you are getting this infection. Basic one-liners. Okay? Basic one-liners. Next question. Here comes our question, right? Every week I am discussing this. I hope from this sessions, what I have thought, I have taken minimum 5 questions of assertion reasoning. This is mostly, what to say, highly predicted questions in this NORCET. I am expecting these questions, right? This is the concept. You just listen what is assertion. We are assessing that, okay? This may be. What is the reason? Regarding that, it is going to give a reason. That is assertion and reasoning, okay? IgG is most abundant immunoglobulin in the serum and provide long-term immunity. Okay. IgG is the first antibody produced in response to an infection. It is correct, IgG. So, A is true, but R is false. So, A is true, R is false. It is correct. Am I right? Yes. Everyone given. Devi, Arogya, Greeny, correct. Nirmala Mary, yes. Rajkumari, Rajadurai, you are correct. Yes, yes. Everyone is correct. Next question. Vaccines provide active artificial immunity. Vaccines provide active artificial immunity. It is correct. Active artificial. Yes, it is correct. Vaccine stimulates the body's immune system to produce antibodies and memory cells. Is it correct? Is it correct? Come on, tell me, is this correct? Vaccine stimulates the body's immune system to produce antibodies and memory cells. Yes. Both A and R are true, and R is the correct explanation of A. Yes. Coming on to this, administration of tetanus toxoid during wound management is an example of secondary prevention. Administration of TT during wound management is an example of secondary prevention. They have given TT, vaccination they have done during wound management is an example of secondary prevention. Is secondary prevention or not? Okay. Secondary prevention aims at early diagnosis and prompt treatment disease. It is correct. Reason is correct. A is correct. Yes. Vaccination is always primary prevention. So that the answer will be D. Yes. Why A? Why you are giving A? Okay. Vaccination comes under secondary prevention or primary prevention? See, first assess, read the question properly. This how you will make mistakes in your NORCET. This how you will make in your competitive exams. Not only in NORCET aspect, but also in every exam. Read the question as much as possible with a keen attention. Don't just like that read an answer. Okay? Yes. Now, vaccination comes under what? Vaccination always primary prevention. Vaccination is always a primary prevention, but they have given secondary prevention, so it is wrong. Here what they tell, secondary prevention aims at early diagnosis and prompt treatment of the disease. Prompt treatment of the disease. Yes, it is diagnostic early and we are going to give the treatment, so that it will be, the reason is correct. Okay, A is false but R is true. Yes, correct. Yes. Don't confuse children. Next question. Breastfeeding provides passive natural immunity to the newborn. Passive natural. Okay, yes. IgA in breast milk offers protection against gastrointestinal infection. IgA in breast milk offers protection against gastrointestinal infection. I think both are true. Passive natural is going to give. Is it correct? Is it correct, children? Anyone can say? Is it correct? How you can say breastfeeding provides passive natural immunity to the newborn? Yes, like that I will confuse. You should not confuse. You should be having the clarity. Yes, you are all correct. Now I felt happy because you understood the concept of immunity and levels of prevention. Mostly go and review in the book or whatever notes you have. Keen attention towards primordial and primary prevention, and once again go through what is BP, screening and monitoring. In related to the scenario it may differ. Okay, yes. Coming on to this next question. School based health education about personal hygiene. This is the last question of the session. Example of primordial prevention. School based health education about personal hygiene is an example of primordial prevention. Irrespective school based health education they have given. Primordial prevention targets modifying existing risk factors in adults. Primordial prevention targets modifying existing risk factors in adult. Existing risk factors in adult it will do. So what may be the answer here? Yes, correct. Yes, here school based health education about personal hygiene they have given, okay, is an example of primordial prevention. Okay, primordial prevention targets modifying risk factors in adults. Here the population they have defined but irrespective of the age group, school age children will have from the age of 18, not specifically we can say 10 years or 10 to 12 years. School age children will be 5 years to 18 years. So these are the age group. Regarding personal hygiene only, the condition is not defined. Okay, the condition is not defined. Okay, yes, A is correct, A is true, but R is false. Okay, R is false because it targets what it targets? Pre-existing. Okay, before emergence of risk factor or more. If there is any thing like that, then it comes under primordial prevention. Okay, yes, that's all for today's session. If you have any doubts, you can ask me now so that I can help you all people. Okay, yes, come on, tell me, is there any doubt, children? If you have any clarity, you had clarity or not? Is the class was boring, children? Yes, no risk. That is the keyword. No risk factor will be present. Okay, the population is not defined. Sometimes the population they may give, they may confuse with school children. School children, if they want to give, if malnutrition, if they given, then it is primary prevention. Only to prevent malnutrition we are going to give. Personal hygiene in the sense, every age people will be having this. Okay, myself, I also need personal hygiene. You people also will need personal hygiene. School children also will need personal hygiene to prevent n number of infections. Irrespective of the disease condition, we are going to give the health education. Then it is primordial prevention. Particularly, personal hygiene is maintained to prevent fungal infection. Particularly to maintain any other condition. Then it is primary prevention. Okay, yes. Thank you for your feedback. Thank you. Not boring, right? Yes. Next week we will be discussing some other important topics related to community health nursing. You can comment that so that I will take the topic in an interesting manner. Like we will discuss lot of MCQs. From MCQs we will learn the theory. Okay? Yes. Thank you so much, children. Thank you so much. Okay? You can explore what I am going to say. So we are having Plan C Plus Economy Edition and Platinum Edition, so that you can download what NNL1 app, which is available in the Play Store, Android. You can download and explore the app. Once you explore, you will like, if you're definitely going to prepare for NORCET, you're going to achieve, then NNL app will be helpful for you. This specifically, this Plan C Plus Economy and Platinum Edition is specifically given you for you people to achieve your your NORCET success. Okay, your dream will be achieved with the help of NNL1. Okay, very happy to be a part of this session. Next week we will discuss some other interesting topic. Okay, thank you all. Thank you, children.